pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, so first on the agenda, we had review and approval of minutes. So we had the minutes from June 9th, which were revised. Did anybody have a chance to review that? Any additions or changes to suggest? Any moving to approve?
I reviewed, but I didn't look for the revisions, but from my perspective, it was fine.
Yeah, the revisions were certainly done. Yep.
So I move to approve.
Second.
Great. And then review of the Board of Health minutes from September 15th. Any additions, changes to that document?
I just had one typo. Otherwise, I would move to approve.
Move to approve with correction of typo.
Second. Great. All right, so just a few comments. Organizational issues. Dave, what is your last month?
I'm not sure.
Okay.
Either next month or...
I knew it was coming fairly
year,
soon.
Either next month or the one.
Okay, before the end of the year. All right, and we do have two potential candidates that Maggie has told me about, and I'll be contacting them this week. So we do have some people who are interested.
Don't we have an open seat already?
Yeah, we already do.
Candidates is a good thing.
Yeah, two candidates is a good thing. So just a quick comment. I don't want to go too much into this because we have a pretty full agenda. That it, as far as for the month, I think most people know that October is very importantly Breast Cancer Awareness Month. It's also Domestic Violence Month. So Dave, wanted to turn it over to you for a communicable disease update.
It becomes progressively more difficult for me to do this because the level of information that we have and the quality of information that we have is absolutely deteriorated. But I would make a couple of quick comments, and then I'd like to read something for into the minutes for the board. So the quick comments are: if you haven't gotten your flu vaccine and you don't have a contradiction to getting your flu vaccine, now is the time. Yesterday was the time. There is not a lot of activity evident yet, except in Japan. There's a raging outbreak, and therefore it's coming here. So it's time to get your flu vaccine. It is very hard to give coherent information about the COVID vaccine because there are so many different factors that each individual needs to take into account in making that decision, and it is nearly impossible at this point to calculate case fatality ratios, remembering that the vaccine is highly effective in at-risk individuals at preventing hospitalizations and deaths, but it is not terribly effective. It has some effectiveness in preventing disease at all, so that in the absence of an understanding of what the risk for severe disease and death is, it is hard to give any broad sweeping recommendations, remembering also that it is not a seasonal infection. We did just come out of a summer bump. We've had summer bumps every year since the beginning. It's pretty much disappeared, and the duration of protection is 4 to 6 months, depending on the robustness of your immune system. So that's really a personal decision that needs to be made with the assistance of your healthcare provider. I would strongly recommend for older and frailer folks that you understand where you stand with regard to your Pneumovax. I shouldn't say Pneumovax, that's a brand name, pneumococcal vaccine. If you've never had a shot, you should get 2 of the new shots. If you've had a 13 or 15 valent, you should get 1 of the new shots. But again, this should be discussed with your healthcare provider. With regard to RSV, it is not yet active, and that's also kind of a personal decision. If you have very little risk of exposure to young folks or exposing young folks, it's a personal decision. If you're around your grandchildren There is a two-way risk there, and it is recommended for people above a certain age who have risk to get the RSV. And that's pretty much all I have that's new for you. On the avian flu front, it does appear that there's an uptick in activity. It is nearly impossible to know because the reporting is not only not robust the way it was, it is actually now appears to be being suppressed. So there's really just not good information on avian flu. But it feels to me like the thing that I could do that is most helpful to the public in general, as my, I guess it's 8 years total of on this board wind down, is to read for you a letter that was written in the form of an op-ed in the Washington Post by 6 prior surgeons general appointed by Clinton, George W. Bush, Obama, Donald Trump, and Joe Biden. And it is a collective letter that was published on October 7th. That would be Jerome Adams, Richard Kimona, Joycelyn Elders, Vivek Murthy, Antonia Novella, and David Satcher. And I'm just going to read it intact because I think there's excellent information to help people get a better understanding of where we stand with regard to public health and decision-making in this country. And from here on in, it is the letter. As former U.S. Surgeons General appointed by every Republican and Democratic president since George H.W. Bush, we have collectively spent decades in service as the nation's doctor. I would also tell you, if you go to the article, there are links providing evidence in the tradition of actually following science and not ideology, and that's one of the links. We took 2 sacred oaths in our lifetime. First, as physicians who swore to care for our patients, and second, as public servants who committed to protecting the health of all Americans. Today, in keeping with those oaths, we are compelled to speak with one voice to say that the actions of Health and Human Services Secretary Robert F. Kennedy, Jr. are endangering the health of the nation. Never before have we issued a joint public warning like this, but the profound, immediate, and unprecedented threat that Kennedy's policies and positions pose to the nation's health cannot be ignored. Despite differences in perspective, we have always been united in an unwavering commitment to science and evidence-based public health. It is that shared principle that led us to this moment. Over recent months, we have watched with increasing alarm as the foundations of our nation's public health system have been undermined. Science and expertise have taken a backseat to ideology and misinformation. Morale has plummeted in our health agencies, and talent is fleeing at a time when we face rising threats from resurgent infectious diseases to worsening chronic illnesses. Repairing this damage requires a leader who respects scientific integrity and transparency, listens to experts, and can restore trust to the federal health apparatus. Instead, Kennedy has become a driving force behind this crisis. HHS, Health and Human Services, is one of the largest civilian agencies in the federal government with a nearly $2 trillion budget and oversight of programs and agencies that touch every American family and business: Medicare, Medicaid, the Centers for Disease Control and Prevention, the Food and Drug Administration, the National Institutes of Health, and more. It requires steady, ethical leadership grounded in science. By contrast, Kennedy has spent decades advancing dangerous and discredited claims about vaccines, most notoriously the thoroughly discredited theory that childhood vaccines cause autism. He has promoted misinformation about the HPV vaccine, which protects against cervical cancer, and he has repeatedly misrepresented the risks of mRNA technology and coronavirus vaccines, despite their life-saving impact during the pandemic. This year, as the United States faces its worst measles outbreak in more than 30 years, Kennedy de-emphasized vaccination and directed agencies' resources towards unproven vitamin therapies. The result? Month-long outbreak, 3 preventable deaths, and the first measles-related child death in the U.S. in over 2 decades. More recently, Kennedy removed every member of the Advisory Committee on Immunization Practices, ACIP, you might have heard it called, replacing its scientific experts with individuals who often lack basic qualifications, some of whom are vaccine conspiracy theorists. The new committee has already begun casting doubt on the hepatitis B vaccine for newborns, despite decades of data affirming its effectiveness and strong safety profile. Discrediting vaccines undermines one of the most important public health tools in American history. Thanks to widespread immunization, we eradicated smallpox, eliminated polio in the United States, and prevented an estimated 1.1 million deaths and 508 million infections among children born between 1994 and 2023. Operation Warp Speed, initiated under President Donald Trump, brought life-saving mRNA vaccines to the world in record time, yet Kennedy continues to ignore science and the public's wishes. Most recently, HHS proposed new warning labels on products containing acetaminophen, Tylenol, citing a supposed link between prenatal use and autism. This move has been widely condemned by the scientific and medical communities, who have pointed out that the available research is inconclusive and insufficient to justify such a warning. In an extraordinary and unprecedented response, the American Academy of Pediatrics, the American College of Obstetrics and Gynecology, and other leading health organizations issued public guidance urging physicians and patients to disregard HHS's recommendations. Instead of helping pregnant women make informed decisions during a critical period in their life, Kennedy's decisions risk causing confusion, fear, and harm. Rather than combating the rapid spread of health misinformation with facts and clarity, Kennedy is amplifying it. The consequences are not abstract. They are measured in lives lost, disease outbreaks, and erosion of public trust that will take years to rebuild. It is essential to note that good science and public health require not only evidence, but also people, the scientists, public health professionals, and civil servants whose expertise protects millions of Americans. Yet, under Kennedy's leadership, the HHS workforce has been badly damaged. He has silenced and sidelined hundreds of scientists, public health officials, and medical professionals, creating an atmosphere of fear and distrust. Many of the nation's top public health professionals, people we have worked with during crises, have resigned or retired early. They describe a culture of intimidation where scientific findings are censored, evidence is disregarded, and career officials are pressured to rubber stamp conclusions that are not backed by science. The shooting at CDC headquarters in Atlanta this year only deepened the crisis. As former commanding officers of the U.S. Public Health Service Commission Corps, we know that caring for your people is the sacred duty of a leader. Yet, in the face of tragedy, Kennedy denigrated CDC staff as corrupt and repeated conspiracy theories that contribute to the targeting of the very staff he is charged with protecting. We will not soon forget the heartbreaking calls received from CDC employees expressing how scared and betrayed they felt for simply doing their jobs to serve the American people. It's worth reminding ourselves what Kennedy puts at risk. The FDA approves life-saving drugs and holds pharmaceutical companies to high standards of safety and effectiveness. The NIH pursues and funds cutting-edge research. CDC leads in emergencies from pandemics to opioids to natural disasters. Agencies at HHS spearhead efforts to address issues regarding mental health, substance use disorders, primary care shortages, and health insurance coverage for millions of seniors, disabled individuals, and low-income Americans. Mismanaging HHS endangers America's health, undermines national security, and damages our economic resilience and international credibility. Americans' public health systems are essential to the well-being of the nation. We are clear-eyed about the fact that these systems need to be improved, including paying more attention to areas such as disease prevention, mental health, and chronic illness. But reform must be grounded in truth, transparency, and scientific evidence. Without this foundation, we risk not only holding progress, but reversing it, costing lives in the process. Secretary Kennedy is entitled to his views, but he is not entitled to put people's health at risk. He has rejected science, misled the public, and compromised the health of Americans. The nation deserves a Health and Human Services Secretary who is committed to scientific integrity and can restore morale and trust in our public health agencies. Having served at senior levels in government, we know that politics are complicated, but this is bigger than politics. It's about putting the health of Americans first. Thanks for your forbearance. I would add my footnote. I agree with everything they said and much, much more.
Anybody have anything to add to the Surgeon General's letter? Okay, so we'll move on.
I've been nearly bursting to give that information for months, and I think that they did better than I could possibly have done.
So an update on our student intern program for the year. We had 17 excellent candidates. I wasn't involved in selecting the candidates, but did look over many of the applications, and just a very impressive group of individuals. Seems like it gets more difficult to determine the interns each year, but we have selected, thank you, Lee and Bob and Dave for looking over the applications. We've selected 2 candidates, Haley Long and Simone Mack, and I wanted to ask them to introduce themselves, what grade they're in, why they were interested in the board, and just a brief comment about what they're interested in looking at.
Hello, my name is Haley Long, and I'm currently a junior at Radnor High School. I was interested in being a student intern because I'm really interested in the field of public health, and I'm excited to learn from professionals in the field about how to effectively treat the issues in our community regarding public health. And for my student project, I wanted to focus on the connection between sleep and academic performance, because as a student, I've seen the impact that sleep can have on academic performance and overall student life. And I believe that is important to share effective strategies that students can use to cope with time management and screen time, and overall just have an effective way of organizing school and sleep. Thank you.
Thank you, Haley.
Hello, my name is Simone Mack. I'm a sophomore at Radnor High School. I've been intrigued by the role of public health leaders in our society since middle school. And personally, I see the study and administration of public health as one of the most important professions in our modern society. I wanted to focus on, primarily for my project, the role of loneliness and how that plays out in our society. I think that it's an underestimated issue for the prevalence that it has in affecting our population. And I primarily wanted to focus on the elderly in our community and highlight their loneliness, their unfortunate loneliness in our community.
Great, Simone. Thank you so much. So I will hook you guys up with who your mentors are going to be. I'll send that email out this week, okay? Thank you so much for joining us.
Thank you.
Welcome.
All right, so tonight I'm very excited. I received wonderful response from Isabel Cook from the Radnor Community Support Unit to give us an update on how everything is going with that program, and she's accompanied this evening by Chief Sergeant Lunger as well. Sorry, Sergeant. All right, all yours.
If you guys have any questions related to law enforcement after this is done, please feel free to ask me, but I'll just turn it over to Isabel. If there's anything law enforcement related I can answer, I'd be happy.
Thank you.
Hi. Oh, can you hear me? Okay. Thank you for inviting me. We actually just passed 2 years since our program started, which is just mind-boggling that 2 years has passed. And it's been busy, but good. So I'm Isabel. I'm the social worker that works within Radnor Police Department. I just came a brief kind of overview of what we've been doing and kind of what we're looking forward to. So just an overview, we were established in 2023 to strengthen our relationships between law enforcement and the community, really focused on strengthening the relationships with local agencies, providers, the hospital, Delaware County, Health and Human Services as a whole. So kind of started with that focus, but also how are we responding to calls and making sure that residents within the township are getting the resources and support they need, so that they're not overburdening the 911 system and a system that is overburdened in general. Just a quick mission to build trust, promote wellness, and enhance safety through community partnership and support, enhance officer and community connections, provide crisis intervention, de-escalation, and mental health resources, and increase accessibility to police and social services. I think probably since 2020, we've seen a push for that. So I would say Chief Flanagan had a vision and felt very passionate about that, and that's why I'm here. Core functions. So community policing, I can go to calls as they're happening for crisis intervention and de-escalation. The community support unit, is the unit that I work with, is for officers that are more specially trained in responding to mental health, substance use, domestic violence, unmet social needs. That's one part of my program, and that kind of goes with mental health response. The other part, follow-up, I will go through, myself or Sergeant Lunger will go through all the incidents from the previous day, and anything that is marked that could benefit from me reaching out to a resident, I will reach out. Officers can send me referrals. I have had people walk in and call me as well, so we kind of take referrals from any kind of source. Increased training and education, so we're always looking for training opportunities with other agencies to come in so that our officers are getting advanced training on trauma-informed care and how trauma impacts how someone might be reacting in a crisis and so forth. And then improved community relationships with providers and agencies. Also mentioned, I didn't put on here, officer wellness. We've been really working on our officer wellness kind of initiative this year. So a few things that I mentioned that are pretty exciting. Partnerships and collaboration. We work really closely with the school district. We were just at the partners meeting this morning, and it was really great to be there and see how our programs have been supporting students in the school district. We work with Eastern University quite a bit. Some county services, MVP Recovery, who provides mental health and substance use for the whole county. We work with really closely. Specifically, they have the LETI program, which is Law Enforcement Treatment Initiative, which gives people that are arrested and are also struggling with substance use the opportunity to get into treatment and potentially have those charges dismissed if they complete what is recommended. Delaware County Health and Human Services. I think most everybody probably is aware, Crozier closed this year, and kind of navigating how do we make sure that people in crisis are still getting the support that they need. So we have been able to kind of develop our own process with Bryn Mawr Hospital to provide efficient and effective responses to people in crisis, and that are also more therapeutically appropriate. We also work victims assistance and the domestic abuse project we're working really close with. And the Guide app, which is connected to our officer wellness initiative. The Township made the decision to invest in that, and it is a anonymous app, free to all of our officers, their spouses, and retirees. And it offers different little micro classes on meditation and breath work, how to manage stress better, relationship issues, I mean, kind of everything. There's little groups that they are joined in that they can post and converse with each other. And there's also journaling prompts. So just some highlights. Just this year, we've had over 200 referrals. That does include one-time contacts. I would say we're probably like 65-70% of success with the amount, like what we're getting, and able to connect those individuals with resources. Our top referrals and kind of trending, what we're seeing right now, a lot of adolescent mental health, specifically boys, 12 to 15, we get a lot of calls for. Domestic violence is always kind of a steady call. And then also a lot of elderly issues and concerns, specific to elderly, health-related barriers, not being able to get out of the house, transportation issues, hoarding we've seen quite a bit of, and then isolation, people by themselves that are totally kind of cut off from the supports that they need. So we also we work very closely with the senior center to make sure that those folks that are in the community are still having contact with people and getting the things that they need. For our Guide app, we meet with them quarterly, and this is we just learned this, that we have a 61% participation of the whole department, which is amazing. Every time we hear that number, we're like, what? So great, it's being used, and we're getting really, really good feedback for that. Part of our or what I've been working with Officer Wellness, vetting private practices and therapists that are culturally competent to first responders. So if we do have officers that are coming that are needing extra support, we are sending them to people that are going to understand what they're dealing with and are going to create like a safe space for them. We've seen an increased request for mental health and relationship-focused support, actively trying to work with our community partners to provide education and outreach events. And we've been receiving good feedback from the community, always looking for that. I would also say, the last time I stood in front of you guys, I think there was still a little like caution about my role and how do I interact with officers, but I feel pretty confident that they are fully bought in. I would say the coolest experience for me was when I started seeing my name get tagged in incidents. So I was like, oh, they get it. So that has been a very like awesome to see that they are seeing the benefit of having me. Just some of our next steps, continued partnership development. I think we can always have stronger relationships with the people and agencies and providers in our communities. I feel very strongly in having warm handoffs as much as I can, eliminating how often someone who is the victim of a crime has to repeat their story, making sure they're not going to call a hotline 25 times. I feel really passionate about that, so just kind of keeping consistently on that. Incorporating feedback surveys in some kind of way. We did try that when we hit our 1 year mark with our officers, but that's might be something we revisit again. Expanding officer wellness initiatives, continuing to strengthen the relationships with our county providers and agencies, and then more advanced specific training specific to mental health, crisis intervention, and trauma-informed practices. CIT is kind of the standard in Delaware County for providers and first responders. It is Chief Flanagan's goal to have every officer in the department trained in CIT. So we're working towards that. Hopefully, we'll have that happen sooner than later. And then that's just my contact information. If anybody ever wants to pop in, I have snacks. I think that's how I won the officers over, was the snacks. But I work right in the admin. I'm always available. I probably do work 24/7, which is not a good like work-life balance, but that's okay because I love what I do. But yeah, if you ever have a question, if anybody has a question, my door is always open. I will always answer the phone, and we're here. Myself and our team is here. Thank you for letting me share.
Can I ask a little bit more specifics? You were saying with the teenage boys, is it depression, anxiety? Is it violence? Is it substance abuse, or is it just kind of combination?
I think it is like the post-COVID group with increased anxiety and truancy, refusing to go to school, and parents are kind of, I think, at their limit, so they'll call us to try to have that intervention. So we have spent a good amount of time educating parents on what is the best way to have this conversation without like doing scared straight with your kids. And that they've been receptive to that conversation. I think our message has been, we don't want anyone to be afraid of the police. We're here as a resource, so how can we like foster that relationship? But yeah, 12 to 15, social media, online kind of activities, all interconnected, but I think it's the post-COVID. I've talked with the school social workers a lot about that, and that's kind of the theory that we're going with. And some violence. I mean, from when I was 14, I don't remember kids being as tall and big as they are now. I mean, I'm small, so I might not be the best judge of character, but kids that are bigger than their parents and single-parent households and not really sure, so it's kind of, I think, the anxiety and isolation that came with COVID.
Yeah. The officers, they said there's 4 officers specifically, and this might be a question. Are those officers specifically trained in this CIT? If you could speak to that. Or if it's a special interest, or kind of how you ended up in that position.
So, yeah, there was, we had a pool of officers who submitted their names to be accepted into the community support unit. And then upon looking at their personnel file and their interviews, we picked 4 officers. And since then, they have received specialized training. We've teamed up with the Lincoln Center, and they've come last year and this year, and just like we talked about, the advanced trauma training and things like that. So we're always looking to do more things, but that's what we're doing now with the Lincoln Center. They've been terrific with us, especially training our community support unit officers to deal with people in a crisis, to know exactly what's going on with them, so they're better equipped to handle those type of incidents when they do come out. In addition to Isabel, if she's here, she responds with them. It's like a multifaceted approach.
Were there a lot of applications for it? Like for officers who?
Right, so it also came with a schedule change, so I'm getting into like
Yeah. So.
minutia
little
here,
bit
but
above
yeah,
and
yeah,
beyond
we
who was
did. We
interested.
had about a dozen officers that we picked from, but because of that schedule change, a lot of people didn't want to change their schedule. So there was other factors other than just
Okay.
the community support unit, yeah.
Interesting.
Mm-hmm.
Yeah. With both of you at the podium, I'm a little nervous about asking this question, and most people know that I'm not afraid usually to speak up. I think there is a public health issue in our community that is at the interface of the mental health of the community. It is an enforcement issue, and it started at the end of during pandemic, and that is angry driving. I'm not even talking about aggressive driving. I am talking about angry driving. And I know it's stupid because there's obviously not an answer, but I just think there's a community awareness piece and a be nice to your neighbors piece here. And I mean, I just see it all the time here in Radnor, where we have so much to be grateful for. And I just thought I'd raise that.
I totally agree with you. And obviously when you're driving a police car, you don't see as much when you're driving your normal car because people tend to, be better behaved in front of you. Sometimes they don't, but I do agree with you. I think it's probably a good idea to team up with our highway traffic safety department, maybe put out a PSA. Be nice to your neighbors. I do agree. People are way more short-fused on the road than they used to be, for sure. I know it is. It's unbelievable. And, just by saving, what are you saving yourself, 30 seconds by some of the actions that people are, it's unbelievable. I agree. I do have. Mm-hmm.
The speed that they get to, so they can either break an axle on the speed hump,
Right.
or jam on the
Right.
millisecond.
Yeah, you're not saving much time.
Question for you. Appreciate everything that you're doing with this work. I think it's so important. Can you just clarify, just for curiosity's sake and just to understand, when there's an officer who's trained in CIT and has been earmarked, has been a part of the unit, where does the handoff occur, or in the middle of an incident, between what you're doing and what the police officer is doing? Can you explain that?
That's always a challenge, and you're getting into, it depends on the time of day, too, because Isabel works 9 to 5. Our community support unit officers work 11 p.m. or 11 a.m. to 11 p.m. And they're always, when a call goes out, especially if it's a priority call, you're going to get the person who works that area to respond directly to the call. So they'll probably be there before the CSU officer. And I think that all depends on the officers, and they work well together. If somebody picks up on, hey, this guy's got this under control, I don't need to step in, or can we just bide a little bit of time, calm people down until Isabel can get there and use her expertise. So I'm hesitant to say there's one approach to every incident because everything's different. It's just time and location is a big thing. But I think all of our officers, are well aware that Isabel's here and she's just a phone call away. So if it's between those hours, we just try to calm everybody down. Use our de-escalation skills until Isabel can get there and provide her support as well.
Is it accurate to say that all of the officers in the force are trained to recognize when the CSU would be appropriate to be
Yes.
activated? So everyone knows
Right.
sort of when we're in that space.
For sure, and being 2 years into it now, I think, Isabel touched on this briefly, but the officers are, tagging her directly on incidents, and it's always in the back of their mind. When we first started, it's like, you don't realize, well, we have a social worker now. So yeah, they're well aware of Isabel and that she's here, and that's, you know, over the course of time, I think that's improved too, just people knowing that she's here and using her capabilities.
I do want to thank Radnor Police Department as well for the Villanova incident with the swatting incident. And, you know, I know as a member of the community, I felt like, Radnor Police is on it.
Yeah.
Seriously. So it was
No
great.
problem.
I'm glad it turned out to be nothing.
Yes, but
and
it's
I
very
appreciate the
unsettling for sure,
response.
but, yep.
Yeah.
Can I mention one more thing? I'm just, this is kind of like a passion project of mine. Delaware County, we are starting a veterans response team. So there will be officers that are veterans in each department throughout the county. We're focusing right now on the biggest departments, so us, Upper Darby, Marple, I believe. There was one more too, and Haverford. And the kind of like with the CSU, if there is a veteran in crisis that has having an encounter with police, we will call one of the VRT officers to come, just because they can connect with veteran to veteran much better than civilian to veteran. So we have 2 officers that are extremely excited with Radnor. Chief Flanagan is all for it. We're going to try to kind of do some education out there and hopefully get the word out and come up with some material to be able to show, because I do think there's probably there are a lot of veterans within Delaware County. So I just wanted to mention that, because it's we just had our first training. We're working very closely with the VA in Coatesville and Philadelphia. So I'm just very excited, and I think it's really cool that we're starting that. So.
Any other questions? Great. Thank you guys so
Sure.
much.
And on behalf of Chief Flanagan, and myself and Isabel, I just want to thank the board for allowing us to come in front of you and just give a little insight on what we do. We're always excited to share that. Chief Flanagan, this was his creation. He deserves a lot of credit for this. I think you're going to see more and more of this in law enforcement, and we already are starting to see it. People are reaching out to us and talking to Isabel. We've hired a social worker now. What do you guys think, and what did you do? And Isabel deserves a ton of credit too. We totally hit a home run by hiring her. So I had to say that also. So thank you again. Thank you to the board for your time tonight. Appreciate it.
Thank you guys so
Take care,
much.
folks. Have a good night.
Appreciate it. All right, so I just wanted to bring up a piece of old business for those who were on the board a few years ago when the Kratom store attempted to open. There is now a different business in that location. I'm not sure what the lawsuit thing's going on, but as far as there is a new business there. And interestingly, there was just a report coming out from the Pennsylvania Department of Health earlier this month that was talking about basically there's been an increased volume of calls related to Kratom and to 7-OH, it's 7-hydroxymitragynine, which is another synthetic product. And there's been more calls regarding this. I think a number of cases for Kratom for 2024 was 58. Through June, there were 31 for Kratom and 7 calls for 7-hydroxymitragynine. And they actually, are looking at all the data from 2022 to 2025. They had 81 individuals who had significant illness. Naloxone had to be administered in 25 individuals, which is pretty substantial since these are, available, at gas stations and other places. 14 individuals were mechanically ventilated. Now, of course, there may have been other substances involved, but at least 5 of those, this is in Pennsylvania, Pennsylvania Poison Control. Some of these may have involved other substances, but at least 5 of the cases were just with Kratom. So that was the only substance on board. So just something to kind of, right now, I think let me just find, there's no FDA-approved indications for Kratom. It's prohibited from marketing as a dietary supplement. And basically the 5-OH products are more concentrated version of the Kratom. and they've become more available, as from the reports, that there were no reported cases in 2024, and there are some reported cases this year. Of course, that is, obviously they've become more aware of it as well. So I just kind of wanted to bring that up. I'm super happy that, I'm sure you can still get kratom at places in our township, but I'm happy that it was not at that location close to the middle school and some of the other local private schools. So new business, I should have mentioned this while she was here. We do have somebody new from the district, Kara Miller, who could only stay for part of the time this evening, but we do have somebody new from the district. I wanted to ask Maggie for an update if there's anything of importance to us from the Board of Commissioners.
Thank you. So I see 9A you have, which I was going to bring up. This particular room is scheduled to be recarpeted, and there's great concern in the community about this. And allergens, molds, other evil things lurking in the carpeting. Unclear what the base is under here. We think it's cement. That's a wooden platform. Concerns about echoing and that sort of thing as sort of the driving toward carpet. A lot of other good data sort of driving against carpet. Anyway, that's out there. It was pulled from the agenda, which was set to receive bids, simply because actually it was set to have a bidder accepted, but it hadn't been uniformly bid out. So it got pulled from the agenda because of that, which gives us a little time to discuss this and kind of rethink what's happening with that. The other big item that's coming from us public health-wise is an ordinance that's sort of being reworked right now. It got tabled 2 Board of Commissioners meetings ago, which is a e-scooter and e-bike safety ordinance, which would require some age limits, some helmets for minors, that sort of safety-driven stuff with these. And since we've been discussing it, boy, don't you see kids going 20 miles an hour with no helmet on these e-scooters through all of our parks. You can watch them outside the Township building, so it's really remarkable, and it's really pretty scary. Interestingly, Pennsylvania state law says that e-scooters may not be used on the roads. They can be used in a bike lane or be used, e-bikes can be pedaled on a sidewalk, not used electronically. They don't address e-scooters on the sidewalks. So we're looking at all of those things and trying to build a safer environment for both the children and adults in Radnor Township. So that one's in the works. Look for it to come back again. I'm not sure it's going to be ready by the end of the month, but we've got Chief Flanagan working from his side. We've got some health and safety folks working on it, and there's just concern in general that, head trauma is lurking. So. The only other thing I wanted to say is, as you had said, there are 2 candidates in the works for the Board of Health that I've interviewed one, but not the other. And I know one has been in touch with you, but we'll be in touch about that.
Yeah, I kind of skipped over that in the agenda because I know that was some of the public comment as well. So I thought we would kind of turn that time back to them. So a quick county update. There are flu vaccination clinics set up throughout the county. You can go on the county website and find free vaccine clinics. There was some interesting data, and I think the plan is in the spring to have somebody from the Board of Health in Delaware County to come and talk about their West Nile virus monitoring. But the data's on there. You can click on where all the positive cases that we're seeing in the mosquitoes, basically have these mosquito traps that they collect, and then they see if they can find it within those areas. They'll have Radnor Township, the location, they'll have, other locations in the county. So something interesting, and that hopefully I know they have a robust monitoring program, so I think that would be something great to get in the spring. right, before we go to public participation, did anybody have any comments or concerns? All right, well, let's open it up to the public.
Good evening. I'm Kathy Wright. I have a master's in nursing, and I'm one of the three of us with Diana Spees-Pope, who's a PhD, and Jillian Norisanto. When the on the Board of Commissioners meeting in September, looking at the agenda, which many of us do to see what's coming up, we saw that they were authorizing the replacement of carpeting in various areas throughout the township building. And I sort of jumped at that because I'm like, oh, you know, dirt and allergens, and where's it going? And, you know, plus this was put in 2008, so now it's being replaced 18 years later. Does this mean it's going to have to be, is this a cost for the township every 18 years? And so we talked about it, and so we looked at the literature, and we just wanted to be sure that the proposal for the carpet replacement in the township building met all of the latest EPA standards. And I mean, we all know that, you know, everything is moving forward with products, with recommendations, with, you know, in buildings inside, outside, up steps, you know, in elevators. So we wanted to look at everything that we could, and minimizing fumes and chemicals. And then what happens if you have carpet? What happens to the wastewater? So hopefully you folks received some articles that were sent. So I'm not preaching, I mean, I'm preaching to the choir, yes. So I had pretty much, that's all I was going to say here tonight to introduce Diana, and just for your listening pleasure.
So I'm just handing out essentially what I'm going to say, so you can follow along. So my name is Diana Pope, and I live at 116 Windermere, and I was an RN for more than 30 years, working in acute care and public health, and then continued my education. So I have a PhD in infectious disease epidemiology, which doesn't relate to what we're talking to today, but it does mean that I believe in evidence. Essentially, I'm just going to read what's here, because it's simply to get on the record the idea of things we need to be thinking about in this day and age. So at this point, carpets significantly impact solid waste, with over 4 billion pounds disposed of annually. So we don't want to add any more of that if we can help it. I'm not arguing against a carpet, quite frankly. It's just because I did some of my research was related to sound, and the carpet plays an enormous role in making this a more pleasant place for meetings. However, so key attributes for greener carpets include low or no volatile organic compounds, VOCs, safer dyes and adhesives, recycled content, and manufacturer take-back programs. Durability is crucial. More durable carpets reduce environmental impacts by minimizing replacement frequency. Proper installation and maintenance, including low-emitting adhesives and recommended cleaning practices, are essential for longevity. When choosing the materials, modular carpet tiles can be more sustainable than broadloom due to easier replacement of individual tiles. Reuse options, such as refurbished carpets made from used materials, contribute to sustainability. Understanding the recycled content of carpet components is vital, as it supports market demand for recycled materials. Manufacturers should produce certification for environmental claims, and recycling mechanisms should be established. Obviously, that's beyond your control, but being aware of the fact that if someone's claiming, you know, like they do with food, you know, that it's healthy in one way or another, when in fact it may or may not actually be. The Environmental Protection Act of 1993 mandates that individuals must take reasonable measures to prevent pollution. Now, I don't know whether that applies to every one of us or whether that just applies to federal employees who are making these purchases. But it's worth trying to abide by that, I would think, in any event. And then in disposal guidelines, this was a little confusing to us because we know that there's a sewer in terms of when they're actually doing a deep cleaning using water for a carpet, that we have a sewer and the water would be going into that. But in this recommendation by the EPA, it was saying that such wastewater should be discharged with prior approval. And I have no idea who would be making such an approval in this setting, but something to think about. But it is testimony to how carpet is inherently contaminated with chemicals that you don't necessarily want to put into your water, your wastewater to go out. Anyway. And then ultimately, there are references and resources for finding out information. There is a professional carpet organization that's in the material you've been sent that seems quite legitimate and has actually reduced their recommendation in households related to allergens and carpet, where for many, many years it said don't put carpet in kids' rooms if they have allergies. And that actually now, even prior to this administration, has been reduced. So whether that's pressure from manufacturers or whether that's actually based on evidence, I cannot tell you. But it does not seem to be as much of an issue as it used to be. Thank you. You have any questions for me?
Okay, thank you so much for your comment. So Maggie, this will be brought up at next month's, it has been tabled till next month, or we're still waiting for information?
It's still, it's out there in limbo right now.
It's in limbo.
But we are discussing
Okay,
these issues. So.
all right, great.
And in fact, it was really on the agenda just for the bidding process, so it's out there a ways.
So if we as a board wanted to make a recommendation, we probably would have time to do so before the carpet is installed.
Certainly before they start putting adhesives down on the
All
floor.
right, excellent. Other public comments this evening? Excellent. All right, well, I will adjourn the meeting for this evening. We'll see everybody next month. Oops, I have to ask for somebody to move to adjourn the meeting. Second. There we go. Thank you.